Good morning, everyone. I think we'll make a start. It's now 10 o'clock. Can I welcome everyone to the first of the Safeguarding Overview and Security Committees, and welcome in particular the new members who perhaps haven't been to one of these committees before. Item 1, is there any apologies?
Just apologies from Cabinet Member Julia Jessel for this meeting.
Thank you. Any declarations of interest? Has everyone had an opportunity to see the minutes of the last meeting? And if so, could I just go through them for accuracy? Page 1, 2, page 3, page 4. Any issues with the minutes? Can I accept them as an accurate record? Thank you. Moving on to item 4, and an introduction to perhaps the main part of this committee, the adult and child safeguarding, and I understand we have a presentation on the, actually I think the presentation is on the second part, isn't it? So when that starts you'll be able to see it on the screen behind me. A brief introduction to the areas of the work covered within the remit of this committee, and the first one is by Ruth Martin, Adult Safeguarding Team Manager. Ruth, over to you.
Thank you, Chair. Good morning, everyone. My name's Ruth Martin. I'm the Adult Safeguarding Team Leader and Manager of the Prisons and Approved Premises Team and Interim Principal Social Worker for Adult Services for the County Council. So my apologies that I haven't prepared a presentation that you can view, but hopefully I'll be able to cover the main points with you as well over the work of adult safeguarding within Staffordshire. So for those of you who don't know, adult safeguarding is covered within the Care Act under Section 42. So for adults who have care and support needs, the local authority has a duty to make inquiries where there are concerns that they may be experiencing abuse or neglect. When the Care Act came in, this actually put adult safeguarding on the same footing as children's safeguarding, which for a number of years prior, as I'm sure you're all aware, had a legal footing, but prior to the Care Act, adult safeguarding didn't. So actually, as a local authority, we do have a duty to ensure that adults in our community are safeguarded against abuse and neglect. And that's the work of my team within Staffordshire. So as you know, we have a Section 75 agreement where the majority of adult social care services are managed and run on a day-to-day basis by Midlands Partnership Foundation Trust, commonly known as MPFT. However, with safeguarding, the local authority retained the duty, so we have a responsibility to make all decisions for safeguarding concerns for adults within our community. So, as I say, that's managed by my service. My service, I have two teams. The first one is the Staffordshire Adult Safeguarding Team, and they are based within the MASH, so the Multi-Agency Safeguarding Hub. And they will make all of the decisions as to whether an inquiry is needed. So, for people who are over the age of 18, who have care and support needs, and those care and support needs have to arise as a result of a learning disability, a physical disability, or a mental health need, and that also does include drug or alcohol misuse. And where they are unable to protect themselves against abuse, or the experiencing or the risk of it, we have to make those necessary inquiries and take steps to protect them. The one thing that I would like to just make clear at this point is that it isn't to do with eligibility for services. So they don't need to meet the eligibility criteria for a paid-for service by the local authority, merely that they have to have care and support needs which prevent them from being able to protect themselves. So we have quite a high demand currently within Staffordshire, and I want to just raise that or bring that to your attention. Over the last year, we have seen an exponential rise in the number of contacts. This time last year, we would receive on average 1,000 contacts per month. We are now receiving 1,700 contacts per month within our service. So we are having to work hard to look at ways to manage that and to ensure that we are meeting the needs of those most at risk within our community. So I can offer you the assurance that that is currently being looked at and that we have a transformation project ongoing within the safeguarding service with the full support of Richard Harling, our director, to look at ways that we can improve the service and the response time. We are well supported by our colleagues and also by our partner agencies, and we are a strategic partner within the Adult Safeguarding Board. So that's the Staffordshire and Stoke-on-Trent Adult Safeguarding Partnership Board, who are responsible for seeking assurances from all agencies that the needs of adults within our communities in relation to safeguarding is being met. They do produce a report that is then viewed by and seen by this committee, and that occurs on an annual basis. So you should be able to see a full record of the work within Staffordshire with regards to ensuring that adults who are experiencing abuse or neglect, that their needs are being appropriately met and agreed. So the last thing that I just want to talk about is the real importance of the work that our service do, and that we wouldn't be able to do this without the support of our partner agencies. It is very complex working with adults when we have to take into account capacity and the other areas to ensure that we support these people effectively. It can be very difficult in some cases to be able to gain access, to be able to support people appropriately. As I'm sure you're all aware, people are obviously very independent and want to maintain their independence and don't necessarily want involvement of adult social care. But by working with our partner organisations, we are much better placed to be able to support them in a way that they want. And that's in line with the national agenda of making safeguarding personal, where this is about us doing safeguarding, ensuring that the phrase is nothing about me without me, and that's what we want to ensure that we do, to make sure that the people in our community get the support that they want in a way that works for them, because if we do it alongside people and with them, then actually we can achieve much better outcomes, and that is the sort of thrust of the work that we try to do within adult safeguarding. So I hope that covers some of the areas. I'm quite happy to take some questions and explore any of that further.
No, thank you for that. That was really useful. Could I just raise one question? I know that unless things have changed, adults nationally weren't always assessed through the MASH process. I know that Staffordshire made a decision to do that some time ago, and I think that is credit to them. Is that process still in place, and is it still effective? Because you were talking earlier about this massive increase in complaints. How do we manage that? How do we assure ourselves that actually we're not missing any threats?
I think you're absolutely right to raise that. It is the increase that is obviously the main concern at the moment and the main area that we need to address. Yes, we do still use the MASH process within adult safeguarding. Not everything goes through the full MASH and is shared with all partner agencies, but that is done when it's appropriate. To look at how we can better manage that increase. So part of that is by looking at new ways that we can utilise our computer system. You may all be aware that it is currently being updated in a couple of weeks' time. So we're getting ready for version 6 of Care Director. And in doing that, we're actually utilising the contact system, which is going to streamline the initial decision-making process. Because what I've identified, and I have just spent the last few weeks doing a large audit, in-depth audit over those that were closing at the early stages, is that we're actually not putting any more through for a full inquiry. So even though we've had this increase in concerns, what we're not seeing is a corresponding increase in full inquiries that are needed. So we're having to look at why we're getting more that don't require an inquiry, and then seeing how we can work with some other agencies and also internally so that we can better manage that. So that we've had a bit of a one-size-fits-all process. You come in and you go through this little system and everybody has the same response. We've had to recognise, obviously, that with the demand, we need to be focusing the majority of our work and of our qualified workers' times to deal with the most significant concerns and look for our other ways to manage some of those lower level concerns. So utilising our colleagues within our quality assurance process to look at concerns that happen within providers, which is, I would say, our largest sector that we receive referrals from. But we need to be doing that sort of proactive work with people so that we can, over time, start reducing the amount that we have coming through. But that is going to take some time.
No, thank you for that. I think coincidentally, I know members are probably aware that there is a report, I think was published this morning, the McAllister report. I know that's to do with child safeguarding, not adult. But it does make the point, and I think as you were echoing there, about how do we manage these increases, and it talks, and it is critical around us perhaps putting too much emphasis on assessment and not enough emphasis on doing. And I think it's encouraging to hear you talk there about making those what must be risk assessed decisions about who needs the help, when, where, and how. And I think that is encouraging to hear. So thank you for that. Is there any other? Yes. Councillor Wilcox.
Thank you, Chairman. Just a question to Ruth. Obviously, during the pandemic, COVID pandemic, a lot of your workforce, I assume, have been working from home. Has that sort of thrown up any challenges for them in as much as referring cases on or being able to visit any of these vulnerable adults, or have they been able to sort of deal with that on a one-to-one basis over the telephone with residents?
Okay, so absolutely the pandemic did, to begin with, cause us some, we had to pause to think about how we were best going to be able to respond, to ensure that we balanced the risks of the pandemic whilst balancing the potential risks for adults in our community. We were very lucky, I think, as an authority, and also, I think, for social work in general. There was a lot of support in how we can assist people virtually. So I think actually the County Council was able to get virtual working in place and give us systems in which we could communicate with people on a virtual basis very quickly. We had to adapt some of our risk assessment process. I'm sure those of you who have worked in public sector will know you rely a lot on your eyes, your ears, what you're seeing, what you're viewing, when you're balancing up what the risks really are. So we had to do some work, obviously, with our social workers around how we can sort of triangulate information to better address risks. Part of the big problem for me was the lack of input and eyes into care providers. And I think in some ways we are starting to see some of the after effects of that now, hence why I think we've had a bit of an increase in referrals. However, from a safeguarding point of view, even during the pandemic, where it was needed, we were risk assessing and still attending in person where we were needed, only under those strict risk assessment guidelines and where there was where we had no other options. We also had good links in with some of our other agencies, for example, police, the fire service, and other people who may be attending homes and people for other reasons who would assist us in addressing some of those concerns. And I actually found, although obviously it was very difficult, a very difficult time for everyone, it was actually quite quite a positive experience in seeing how well people did come together, how well actually people understood the predicament everybody was experiencing, and so worked really hard and really closely together to try and address that. So I think it was overall, I think we were quite well able to manage that.
Ruth, thank you for that. Any other questions? Thank you very much. That was really, really helpful. And if we move on to the second part, Helen Riley, Deputy Chief Executive Director of Families and Communities around children's safety. Over to you, Helen.
Good morning, everybody. It's lovely to see everyone in person. I think most people know me, although not all. For those who don't, I am Helen Riley. Just a little background, I've been with the council for 17 years, I think, and counting. I've been a director for the last 10 years, and for the last 6 years, director of families and communities, which includes children's social care. And I'm hoping Helen, the other Helen, is going to brilliantly move the slides on for me, which we will make available, obviously, to you at the end. So, Helen, if we move on.
It's being pressed, but at the moment it's not moving on. Slightly concerning.
Oh. Oh, there we go.
Perfect.
So, just, I suppose, the headlines for the Scrutiny Committee of the areas that you will be over the next 4 years scrutinising. So, obviously, children's social care, the commissioning that we do as a council for services for children and families, community safety in a broader sense, which I know for those of you who are district and borough members will be familiar with, regulatory services, which is trading standards and animal health, and as Ruth has already touched on, adult safeguarding. So all of those, with the exception of adult safeguarding, sit in my directorate. And just for absolute clarity, the other bit of my directorate, which is education, and particularly education attainment, sits with a different scrutiny committee, although we do look at children with disabilities and their educational achievement as part of this committee. So I thought it would be useful in terms of setting some context around children. I know you probably won't be able to see that, I've just realised, but hopefully when it comes around you will. To demonstrate that actually most children in families in Staffordshire lead a good life, it's a good place to live, and our interaction with them is not forced by legislation because they prosper, they do as well as they can. So this kind of demonstrates that, that 3 children live in households where no adults are in employment out of 100, 95 out of 100 attend school regularly, 89 out of 100 have a good oral hygiene, 84 out of 100 don't live in low-income households. And those 84s and 95s are the children that access our universal services, principally education, public health, and where children's social care are not involved. So just trying to really demonstrate that actually for most families and children in Staffordshire, they lead a good life that doesn't need the support of County Council and its partners. But there are some families and children that we do work with in children's social care. Just wait for the next slide. I think before I go through the various services that we provide in children's social care, I think one of the things to, I suppose, remind members about is that the children's social care workforce is probably the biggest part of the County Council's workforce that is directly employed by us. So over 1,000 staff in children's social care across the county, over 40 social work teams based across the county, and it is the most and most heavily regulated service that we have. So you'll be aware that Ofsted obviously inspects schools, but actually Ofsted always also inspects and regulates children's social care across the whole continuum. We are usually, pre-COVID, inspected in some form at least once a year, with a full inspection every 2 to 3 years. Staffordshire's children's social care services are rated good. They have been good since 2014, and they were the first children's services, or we were the first children's services in the West Midlands to be rated so, which is something that the organisation, given the very, very difficult years we've had, both through austerity and through the last 18 months of COVID, I think is something as an organisation to be proud of. We do deliver a service for 24 hours a day, every single day of the year. So we have an emergency duty service, which obviously picks up referrals or any crises that happen out of office hours, and they act immediately once a crisis or a referral comes in. But normally, in office hours, we have a service called First Response, and that is, in the vernacular, is usually called the front door. So that is how referrals are made into children's social care. It's based in a building on Stone Road. It sits alongside the multi-agency safeguarding hub, and we have a number of professionals that sit in there that take referrals principally from schools, principally from the police, but from other partners including health and members of the public. All those referrals are talked through. Those referrals are triangulated with information we may or may already not hold on the family, and where appropriate, they go through, as Ruth articulated for adults, to a multi-agency discussion where we pull the information we know about that family, the risk level, and where we think the best intervention sits. The first thing in an inspection that is ever checked is called your front door. Because if Ofsted feel that your front door is not effective and that your thresholds is, as in, so how severe is the crisis or not for the child or family, is not operating correctly, you fail immediately. And on any day of any inspection I've ever been involved with, it's the first place they go, and at 3 o'clock we all sit there waiting for a phone call for somebody to say the front door is safe. Because once we know that, it means we've passed the first hurdle of that inspection and that we're dealing appropriately with the referrals that come into us. So once we have a referral, there are a number of services that we offer. The first is called early help. That isn't a statutory children's social care service. That is early intervention and prevention when we think a family are wobbling, but don't reach crisis point, but need a bit of support, principally through family support workers, not necessarily social workers, that will work alongside the family and with partners to try and address whatever that issue is. Many authorities, when we've had to make budget reductions over the last 9 or 10 years, I guess, do not have an in-house early help offer. It's provided elsewhere. I think Staffordshire is very fortunate that we've still managed to invest and keep in that kind of, as part of our service offer, an early help offer. We also have other offers out in the community, through the community and voluntary sector, around early help as well, but we still have that local offer. And at the end of May, we were supporting 1,774 children with that early help offer. The first level then of statutory services is what's called children in need. So that is where we think it's slightly more than early help, that there is a low-level risk and that we need to work alongside the family with a social work assessment. So that's when the social worker gets involved. There's a social work assessment, but principally the work for the child in need is delivered through family support workers, which may be supporting mum around parenting classes. It might be looking at supporting the family on nutrition, on exercise, or on how to budget better, or how to take out any risk which is in the family home. And we support currently around 2,876 children that are classed as children in need. As you go up the continuum, the next level is called child protection. So that is work led by a social worker with a family where the assessment has showed that there is risk of harm unless we intervene with the social worker and family support and try and put right what is going wrong. Children under child protection have what's called a child protection plan, which sets out for a 3-month, 6-month period how we need to work with the family to improve the home environment. And that is monitored regularly through multi-agency meetings. Those meetings are chaired by an independent chair, so somebody who isn't part of the social work service, to check that the family are being supported appropriately, and that plan is reviewed and amended if necessary. I think what's important to recognise at the moment, that if we were sitting here 10 years ago and we were talking in the terms I've just talked about around that continuum, we would be talking about a risk in the home or in the extended home, so risk from friends or family members. Whilst we still have that, what we have seen, and you will be aware of, I'm sure, over the last 10 years or so, is the growth of what is called contextualised safeguarding. That is where the risk is not in the home. So things like child sexual exploitation, county lines, gangs, where it isn't actually the family and the extended family that we see as that we need to work with, but it is a risk from outside the home. Young people that people are associated with, increasing the activity across social media, which I'm sure you're all aware of, and our approach to social work has had to change then to match the different kind of threat. So we still have the work that we do intensively in homes with families, but actually we do a lot more multi-agency work now around places where young people gather, supermarket car parks, parks of an evening, where we're aware that those involved in gangs or running drugs through county lines will be trying to infiltrate and influence young people. So social work has changed over the years with the different levels of threat. There are numerous legislative requirements and pieces of legislation around children's social care, which I won't bore you with at the moment. But I guess if you go back to the essence of the 1989 Children's Act and picking up what was said earlier by the chair around the Josh McAllister review, which I will also pick up later, the fundamental role of children's social care is to support families to stay together safely. That's what the Children's Act 1989 said, unless it is absolutely clear it is not safe to do so. And I think it's always worth remembering that, because that's our prime legislation, and that is how the phrase is for children's social care, to work and to support families to stay together. So unfortunately, as you are well aware, we do have children that move through a child protection plan where the risk, through constant kind of conversations with the family, with other professionals, assesses it isn't safe for children to remain at home. And there are two routes for children into care. One is through legal proceedings which we instigate. It is never social care's decision to bring a child into care. It is a court decision through the family court. We present a case. Parents can present a case back, and the judge reaches a decision. So it is never me, for example, or a social worker making that final judgment. There is always a neutral arbiter, for want of a better term, and that's called coming into care through Section 117. However, there is also another route into care, which is called Section 20, which is of the legislation, which is actually where families, and there are a number of them, say we can't cope anymore. It is often with teenagers involved in things like CSE and county lines. We are at our wits' end, we don't know what to do, we cannot keep our child safe, effectively please take them. And that is called a Section 20. So at the moment, we have around 1,220 children in our care, which is a significant increase from 2.5 years ago, maybe 3 years ago now, when it was under 900. So what we've seen in Staffordshire, as we've seen across the whole country, is a huge increase, actually, in the number of percentage of children coming into care, which, speaking honestly, I think is a reaction nationally to some coverage that you get when a case goes wrong, because social workers are often damned if they do and damned if they don't. And you only need one national high-profile case. Peter Connolly was the spark for the increase of children in care numbers, because what we saw was then the level of risk that social workers were managing reduce. And I think everybody could understand that when you see what happens to people like Sharon Shoesmith and others when one case goes tragically wrong, but doesn't reflect the thousands and thousands of cases that actually go very well. But it was a professional response, I think, to the rhetoric from Ofsted around children's services not managing risk appropriately and needing to intervene more. We also, in our children's social care services, cover children with a disability that meet an assessment where their needs are needed to be supported. And if any child that receives services from us is classed as a child in need if they have a disability. And we support at any one time around 480, 490 children that have a disability. That is basically work with parents to ensure that any medical support is going in, and that things like respite care are provided for parents, are provided for the child, so there is respite for the parents and other support around adaptations to the home. So that's children's social care. In terms of then children in our care, we have a number of services. Once a child becomes one of ours, we have extensive fostering services, which I'm sure you're all aware of. We run campaigns regularly, nearly all year, to increase our number of foster carers. The challenge for us at the moment is finding foster carers for those teenagers with very, very complex needs, who have been involved in things like county lines, who have significant mental health problems, maybe drug and alcohol problems, and the foster carers that we require for that need to be extremely resilient, as you can imagine, and have a high level of expertise, and there is a very small number nationally. We are increasing our cohort, and we're running several projects with neighbouring authorities to try and grow our own across the West Midlands. Adoption, you'll be familiar with. We have our own adoption agency, which is regulated, but we also use independent adoption agencies as well, if we do not have enough support locally. Over the last 12 months, we have joined a partnership with Stoke City Council, Shropshire Council, and Telford and Wrekin Council to make one adoption agency across the 4 local authority areas. That was a national requirement, introduced when David Cameron was Prime Minister, when there was a real push on adoption for sub-regions, for local authorities to join together through economies of scale, managing to generate more potential adopters. That's been up and running for a year and is going very well. Unfortunately, when we can't find foster carers or adopters, some of our young people, particularly those very, very complex young people, end up in residential care. Staffordshire has very little of its own permanent residential care anymore. We do have respite care, but we generally have to use the market. I'm sure you'll have seen the national coverage over the last couple of years around the state of the children's residential market. At any one time, any placement in residential care can cost us up to £8,000 to £10,000 a week for the most complex young people. As a result of that, we are currently looking to start our own residential care again, and we have recently purchased a property on Newport Road in Stafford, which will be run by the local authority, registered with Ofsted, and that is the start of us trying again to develop our own residential care. This is not the children's homes that we may all remember from our youth. These are very normal looking houses that will only take 3 or 4 children at a time, trying to get away from that institutional view of a children's home. That's the start for us, and we hope to accelerate that over the next few years. One of the other things we always look at is kinship care. So as an alternative to taking a child into residential care, who is there, or is there an option around the extended family, grandparents, aunts, uncles, that actually are willing to step in and care for that child? They will still receive support through our social work teams. They will still be classed as a child in our care, But it is far better for a child, obviously, to be placed with people they know, with people they're familiar with, than placed in a residential home that, frankly, sometimes could be in Cornwall or Scotland. So we always try and look at that broader picture around whether anybody local to the family can support them. For every child, for every 1,200 children in our care, the council becomes the corporate parent. It is a really, really important job of the council to make sure that those young people that are in our care are cared for and have the same opportunities in life as if they were our own direct children. We have a corporate and parenting panel, which the cabinet member chairs, and as part of that arrangement, we have what's called a virtual school. So within the council, we have a virtual school head teacher, who is Sarah Rivers, and Sarah's responsibility is to make sure that all the children who are in our care are receiving the best education that they can, are supported to achieve what they want to do, to go to university, and I'm really pleased to say the numbers we get to university every year increase year on year, and her job is to work with schools directly and the young people to make sure that they're fulfilling their potential. Today we've received notification, actually just before I came into this meeting, that that role will expand. It will no longer just be for children who are in care, it will be for all children who have a social worker. Not to the same degree. We still work directly only with children in care, but for that broader cohort of children, it will be ensuring that across the county, services meet their needs broadly. But the corporate parenting role is really, really important, and it is, again, something that Ofsted looks at very, very closely when they inspect us. Are the council members involved and taking ownership of the children that are ours? So they're the statutory services. We then have what's called some preventative services, which builds on early help, but is early help plus. And we try and look at what we can put in place to stop young people who are teetering on the edge of coming into care in short-term, focused, targeted interventions. So we have what's called an intensive prevention service, and that is literally what it says. We put family support workers and social workers alongside a family, and we work basically 24/7 to keep that family together for a short period of time. We have something called family group conferencing, which is where when a family are in crisis, at any stage in our continuum, we bring not only mum and dad or the carers together, we bring family members, we bring the young person or young people, and we bring friends, those who have got an interest in the family, and together, collectively, we work on a plan for the family, on what we all need collectively to do to address. Family group conferencing across the country is the one thing that every local authority would point at that says it makes the most difference for keeping children out of care. We have intensive support services for young people who are in families that are struggling with drug and alcohol addiction. We have something called Breathing Space, which is a programme for young mums, or not necessarily young mums, but for females who repeatedly become pregnant and we take their children away. So this is to try and intervene with them, to stop that pattern, understand that pattern of repeat pregnancies. And we have one lady where we have had to take 8 children over the years into care. So this is to try and work around education, aspiration, try to get to the nut of the problem of why being pregnant and having a child seems to be the answering point, but also, and we have a really high success rate of this, where those young women are pregnant and do give birth, working intensively with them to try and keep them together with their child, so that we stop that cycle of child removed, pregnancy, child removed, and it is a really, really successful project. We do in Staffordshire have unaccompanied asylum-seeking children. No doubt you will have all read about the issues that Kent and others are facing at the moment. Actually, Staffordshire over the years has had a significant amount of unaccompanied asylum-seeking children because of the M6, and there are service stations on the M6, and wherever a young person without an adult with them puts foot on land and is found, that is their home authority. So I think at the moment we have around 40. We've had upwards of 100 in the past, but we also do, as we did last year and we will be doing this year, offer support to local authorities like Kent, and actually take some of those young people into our care, and we're expecting 6 from Kent this week. They tend to be older children. They tend to be in the teenage years. They actually have flourished in Staffordshire. For those that have been with us some years, many have gone to university, if not all of them. Many of them have been in very successful fostering placements and have gone on to do really, really well locally and to give an awful lot back to Staffordshire society. When children leave care, which they can at 18 by statute, we do offer a staying put offer with foster carers, so we don't say 18 off you go, find your own way in the world. We do, with foster carers agreement, still support those young people to stay with the foster family, particularly if they've been with them a long time and they are part of that family, and many of our care leavers take up that offer. For those that don't, or those that leave residential, we support them to find what's accommodation and support them towards independence. Support to find a job, support to budget, to manage money, to find somewhere to live, and we stay with them through their 20s if they want that. They don't all want that, as you can imagine, but we try and keep in contact with as many of our care leavers as they go into early adulthood as we can. And I've said already, we work with the children with disabilities, and I also have, which will form part of the remit of this committee, the Youth Offending Service, which sits within my world, which is delivered through Children's Services, but is funded through partnership. And that partnership meets as a board to oversee, in the broader sense, the activity of youth offending. In terms then of other services for families and communities, as well as delivering a lot of services ourselves, we also commission other organisations to deliver on our behalf. So within my directorate, we're responsible for children's public health, and so we commission the Healthy Child programme, so that is health visiting and school nursing, as you will all know it. So that is commissioned through my services, through Natasha, who's with us today. We also commission services to support the reduction in infant mortality and also well-being in a broad sense. We deliver other services around early help outside of our social care services through what's called, nationally had been called the Troubled Families Programme, which I'm sure you've all heard of, is now called the Supporting Families Programme, where we work in a multi-agency way with the family around all their issues to try and prevent needs escalating and that impacting on the children. And in terms of delivery of that programme, we're one of the most successful in the country and one of the few to have what's called earned autonomy. So it was a payment by results national scheme in Staffordshire because they're confident that we do this well, we get the money up front. We also commission support for those who are victims of domestic abuse and increasingly for perpetrators of domestic abuse. We commission support for children's disability services in terms of breaks for children with disabilities in the community. And we also commission services for to support those that have undergone, tragically, child sexual exploitation. And it is alive and kicking in Staffordshire. I know people tend to associate it with all those that get the headlines on the news, but this is everywhere. And there are operations running at the moment, and Staffordshire is not immune from this in any way. But we commission services to support the victims of that, and also a service for children who go missing. So when a child goes missing from home, if they're known to us, we will do, when they're returned to home, working with the police, we will do an interview with that child to see what the issues were, if there's anything we can do to help. But mostly this service relates to children who are in care and principally in residential care. And 9 times out of 10, those children have left residential care to come home to see their friends and to see their family. But we need to know why they've gone missing, and then they're not being exploited basically while they're out of sight. We deliver a statutory service around children's centres and family hubs across the county, and again linking to, I guess, linked across to the unaccompanied asylum-seeking children, we also commission support for the Vulnerable Person Resettlement Scheme, so people who arrive as adults in the country as well, seeking asylum and support. We do that in some instances on our own, but in many, many instances, whatever we commission is in partnership, usually with the police, district and borough councils, and health. Moving on very quickly, so I'm conscious of time and I'm talking forever because it is a massive remit. I wanted to go back to the Josh McAllister report which came out this morning, which talked about children's social care moving from needing to move from supporting families rather than assessing families. Helen, if we could have the next slide, thank you. At the moment, some of you will be aware, in children and family services, so that's over 2,200 staff. We're currently in the middle of a major change programme, and really that is in recognition that we need to change the way we work with families. So we've introduced across all services what's called a restorative practice model. That is a model which is about working with families rather than doing to families. It's a model which starts with what can families do rather than what they can't do, and it seeks to manage risk very effectively, but seeks to keep families together wherever it is safe to do so. In order to facilitate that practice model, what we are doing is restructuring, and we are trying to put on a district footprint as many of our operational services as possible so they can be accessed locally and in an integrated way through a single team. So what our families tell us is they tell their stories multiple times to multiple agencies over and over again, and at any time in children and family services you can have around 57 different assessments that all say more or less the same thing and have a plan which is more or less the same but slightly different. So our aim is for children and families to tell their story once, irrespective of their need, be that an education need, be it an early help need, be it a social work need, be it a need with disabilities, and have integrated services locally where all those professionals that have a contribution to make to the well-being of that family will come together once from day one with one single integrated plan, hopefully, and work alongside them, rather than having multiple professionals visiting multiple times and multiple plans to work to. So I've just included that so that you can see, I guess, what will sit in the district. And we are in the process at the moment of just about starting appointment to some of those posts, and as local members, you'll be particularly interested, I think, as we go through that, in who your local leads were. And so in a district, if we could move on, Helen, sorry, we will have early help and inclusion. That will include SEND, so special educational needs. It will include family support. It will include early help. It will include children's centres. We will have all children's social care services in need, children in need, child protection. It will have all our care and court work locally. It will have education welfare. We will have adult specialist workers who will work directly with the family around parental mental health issues, parental debt issues, parental drug and alcohol issues, and they will be a multi-focused team, or all working together depending on the need to keep the family as safe as they can be and together for as long as possible. Moving away from children's social care onto community safety, we have a small Safer Communities team which will work closely with all those involved in community safety across the county. We have partnership priorities, joint working, which is coordinated at a county-wide level, which is overseen by the Staffordshire Safer and Stronger strategy group, which I think is chaired by the Cabinet Member for Communities. We have a statutory requirement to produce a county-wide community safety agreement, But we are actually looking at the moment around how we streamline some of the governance around community safety and safeguarding, because there is frequently duplication, particularly around things like county lines. Is it a community safety issue? Is it a safeguarding issue? It's both, but how do we actually eradicate duplication? But you will be aware, for those of you who are district and borough members, obviously that there are a huge amount of responsibilities that also sit at that level. So we do have a community safety agreement, which are informed by strategic analysis, and the key priorities for the safety agreement, I'm just waiting for Helen to, that's it, are domestic abuse, contextualised safeguarding, violence in public places, modern slavery, community cohesion, antisocial behaviour and fraud. And hence why there is the conversation around governance, because I've already, in terms of children's partnerships, talked about domestic abuse, vulnerable children and contextual safeguarding, violence, and the linking with modern slavery. So you can see how close the two agendas align to each other. Getting to the end now, you'll be pleased to know. In terms then of regulatory services for this committee, that is principally trading standards, which enforces over 260 pieces of different legislation around food standards, age-restricted sales, animal health, consumer protection, and also oversees the safety of sports grounds. And they provide a continuum of service from advice to businesses and consumers, actually through to enforcement. They have been hugely active over the last 15 months in tackling COVID-relating scams, which have gone through the roof, as I'm sure you'll be aware of and will have read about in the press. They administer the Safety of Sports Ground Act 1975 and the Fire Safety and Safety at Sports Grounds Act 1987 in respect of the 8 stands and sports grounds that we have in Staffordshire, and that's an annual inspection. And we also have, sitting within this part of my directorate, responsibility for the Coroner's Service for South Staffordshire, which there is a coroner for North Staffordshire, and Stoke kind of administer that element of the arrangement, but for South Staffordshire, that also sits within my management structure. Turning finally then to recommendations from me around the standing items that you should look at least once a year. We have, as we are statutorily required, a Staffordshire Safeguarding Children's Partnership, which brings the 3 accountable partners for children's safeguarding, which is the local authority, the clinical commissioning groups, and the police together to ensure ourselves that children across the county are safe. That includes working with over 440 schools around their approach to keeping children safe. We are obliged to produce a report annually around the activity and the assurance that we've sought, and that should come here. We also produce a complaint report every year around the complaints and the trends and the learning that we have from children's social care. We have brought for the last 3 or 4 years very regular updates on child exploitation in the broadest sense and what we're doing about that, either as a single authority and with partners. And you will need, as we go through into October, when we will go live with our new Children and Families transformation, regular updates that is achieving what we hoped to achieve in the original business case. And I'm sure you'll be relieved to know that's it. Thank you.
Helen, thank you very much for that. That's particularly challenging and complicated areas of business. And it's particularly pleasing to hear of the successes. I know you gave the example there of the unaccompanied asylum-seeking children and the outcomes that we are able to provide for them, and I think that is admirable. One of the things that I would ask, if I could, is that we have, in the not too distant past, of course, had Ofsted inspections. We've had joint inspections of things like our SEND arrangements and even a serious case review. Whilst many of them highlighted areas of good work, they did have some criticism within them. And I know that there's been a huge amount of change, and the district model that you outlined quite comprehensively, and also those reports are evidence of that, and most of that under your leadership, of course. I suppose two questions. How confident are we now that we're in a different place than perhaps we were a few years ago? And do we have any evidence around reassuring ourselves of the fact that we're in a better place? And just going back to your last slide there, do you think that those reports are the reports that will provide us with that reassurance that we are able to answer some of those previous criticisms? Thank you.
So if I take the last one first, not in entirety, no. So I think you will need, I guess the last point, regular updates on the children's and families transformation, because the rationale for what the change we're making was around delivering those better outcomes. And we've committed that to paper on what we hope to achieve. And also, to save the authority money by doing what we're trying to do. So I think those regular updates on children and families transformation, which will capture performance in the round, will give that. We may need to nuance them and agree the regularity of them, but I would think quarterly would be helpful. And then I suggest any concerns arising from that, where you want to deep dive on a specific issue, then we can obviously bring that back to a future meeting. Are we in a different place? As I said, I guess at the outcomes, Staffordshire has been a good children's services authority for the last 6 years or so. But like everywhere else, things go wrong and we have ups and downs. One of the challenges that all local authorities face at the moment nationally is social work recruitment. There are we are 10,000 short, we are 10,000 social workers short of being able to fully staff every local authority in the country, which means that there is an ongoing and constant competition for social workers. What Staffordshire is renowned for is the way it trains its social workers once they join us. We have one of the best training offers in the country, and we support staff really well. And what other local authorities are really good at is waiting for 3 years when we've done that and then come knocking on the door and say, come to us for a golden hello, sign the dotted line, we'll give you £3,000, etc., etc. And that happens all the time. It's happened for the last 5 years. And that ebbs and flows then in terms of retention. And at the moment, our vacancy rate is the lowest in the West Midlands, but it's higher than it's been for a couple of years. So it's 8%. We're normally 7%. To put that in perspective, if you were sitting in Dudley and I was giving this presentation, the vacancy rate for social workers is 52%. So whilst we have challenges, we don't face some of the challenges that our colleagues do. I think if you look back at Ofsted comments over recent inspections, they said we were extremely adept at dealing with child sexual exploitation, but we needed to expand that to broader groups of exploitation around county lines, gangs, modern slavery. I think we've done that successfully over the last 2 years, and you get regular updates on that as well. You'll be able to assure yourselves or not of that. So I think we've done that. One of the real challenges for Staffordshire has been, over the last couple of years really, what we've seen in social work practice was almost a move to a police-type model. And what I mean by that is when police colleagues are making a decision around whether to prosecute, there's a line that has to be, there has to be an offence, something that somebody can point at and say, that happened then. Challenge for social work nationally has been the impact of what's called low-level neglect in families. So no event happening that somebody said, right, that's stepped over the line, we need to do more intervention, we need to work differently with the family. What has been really difficult to recognise, and it's only just emerging really, is on the evidence base, is the insidious nature of what's called low-level neglect. So where there's neglect of children at a low level, but for years and years around clothing, around food, around love, around affection, but there is no event, if that makes sense, that pushes a social worker to say, actually that's crossed a threshold. That is not to say that all those families that we work with who are in that neglect category means that all children should go to child protection plans. What it means is that we needed to understand the impact of that low-level neglect and put in place a child in need plan which worked differently with the family. The real example of where we didn't do that well was, as those of you will be aware, the tragic case of the Stafford fire in 2019, where we saw a number of young children perish, where there had been low-level neglect identified for some time, but up to that point, nothing that really, no event that pushed over. But we didn't know, our social workers didn't really have the skills, we hadn't equipped them with the skills of how to work differently with the family to combat that neglect. What we did was note it, if I'm honest. So over the last year, we've been rolling out some work that we've done with the with Children's Society around what's called, it's horrible to, Grade 2 Neglect Care Profile, which is basically training on how to deal with low-level neglect, how to work differently with the family, how to work alongside them, and to try and ensure that we see that difference. That is for those families that want to change. There will be some families who don't want to change, and that is where we have to take a slightly different approach. And I suppose an example of that to make, because it's all children's service jargon, isn't it? I suppose an example of that would be moving from a social worker or a family support worker going in, seeing mum and baby, having said, 3 weeks before, child's diet's not good enough, not balanced, you need to be taking better care of nutrition, you need to be doing, various things around menu management. I'm coming back in 3 weeks to see if you've made a difference. Actually, what we would do now with the restorative practice model that we've introduced and the care graded profile would be to say, oh, actually, I don't think that's the best kind of thing, for Johnny to be eating. Get your coat on. Let's go down the supermarket. I'll walk around with you. I'll say you need 3 of those, 2 of those, 1 of those. I'll show you how to budget over the month to be able to afford that. We'll come back, we'll knock up a couple of meals so you know what to do. And then hopefully when I come back in 3 weeks, you'll have been able to, you've been able to take that forward. Any problems, here's my number, give me a ring. And I guess that will be the difference. Could I hand on heart, Chair, say 100% of the time that is absolutely as effective as we want it to be? Be a really foolish Director of Children's Services who ever said that. Do I think we're getting better? Yes.
No, certainly everything I hear, I think we are getting better. It's just, given the remit of scrutiny panels, it is about asking those questions to reassure ourselves. The final question, well, I suppose one comment and a question. I thought we had a memorandum of understanding around payment for social workers to prevent what you talked about. I assume there's some flexibility in that. The last question goes back to the McAllister report that was published today, and I'd urge everyone to read it if you haven't seen it already. And our restorative practice model that you talked about earlier, it does seem to be the right way forward about supporting people, supporting families and problematic situations within families. I assume, though, to make sure that we do that safely, that's about enhanced risk assessments around, because we're leaving people perhaps in situations that we might not have done previously. If the McAllister recommendations are about less assessment, more doing, does that compromise in any way our restorative practices?
So in terms of the MOU, that was a regional memorandum of understanding around the rates that we'll pay agency social workers. Having said that, that has fractured completely over the last 6 months because the same battle is now happening for agency social workers. We're actually in the process of, as a region, reviewing that at the moment. The latest example of that really is, I'm sure everyone's aware of Herefordshire's difficulties at the moment. Herefordshire have just gone out to the market for 40 agency social workers, paying £44 an hour when the MOU rate is £34 an hour, which means that every agency worker that every local authority in the West Midlands has got is getting up and going off to places where they can pay more money, which is why we don't really, we want as few agency workers. We obviously use them things like maternity leave and the rest of it, but so that's the MOU. In terms of the restorative practice model, I think we're a bit ahead of the game in the direction that Josh is going. There is no doubt, as I said, that over the last 2 years particularly, the amount of children in care in England and Wales has risen hugely. And I've speculated already on one of the reasons for that. The restorative practice model is about working with and not over-assessing, but it is about actually spending time with the family. It does mean, as you've said, that we really have to have excellent management practice around managing risk and excellent supervision, which is also another stream of the workforce transformation. What the restorative practice model doesn't do is say where a social worker sees no sign that a family who appears to be posing a risk to children either through neglect, which is mainly what it is, or through any other means, show no signs, willingness to engage or want to improve, that child will not remain in that home. So it is with those families that love their children, and we see, most 99% of the families that we do really love their children, that want their children to stay with them, that they want to be successful parents, but need support to be able to do that. What we've seen over the last 2 years is social workers, I guess, and people like me being judge and jury, saying it's not good enough child into care without doing that direct work, and really taking the time to see whether families can stay together safely. Because every study that's done, and I know I mentioned this many times in the last administration, and there's multiple national evidence on that now, even where children come into care, their outcomes in terms of educational achievement, what they achieve in the rest of their lives, is never as good as those children that stayed in homes that you and I might think was a bit chaotic, wouldn't be the homes that that we might have had or think is what good parenting looks like, but still the children of those homes where they're safe, but where life's a bit chaotic, are still much better than for children that come into care.
No, like I say, that's really encouraging. Thank you for that. Anyone else have any questions? Councillor Perry.
Yes, just very briefly, thank you very much for the two presentations. Can you hear me? Sorry. Yes, thank you. Sorry, it's my microphone there. There's a lot to take in there. Is it possible we could have a copy of those slides that you've just put up there, please? Because there's an awful lot to take in this morning. And the question I wanted to ask, on 2 or 3 slides back, you mentioned district models. Is there any overlap on these district models? Is it a boundary district borough, or are there overlaps? I'm only asking because I know in my division we do get services from Cannock, or is this in this case an actual district borough model that we're using? Thank you.
The principle is a district model, so it is 8 to mirror the 8 districts. Disability services are on a double district because we work with less children, but what has been absolutely clear as a principle as we go through this is that the 8 managers that will be the senior manager in each district are expected to work together as a team, and where services do cross boundaries, then the social worker, for example, would follow the child. So it is to try and we have to put some structure around it, and and so we've mirrored the district and borough structure, which we don't have at the moment. But what it isn't is set in stone in terms of the way services will be delivered. One of the principles has been around being flexible and resources following the child, if that helps, Kath.
Thank you for that. Councillor Burnett.
Hello. I wanted to ask a question, Helen, about this new residential facility. We've got quite a few private ones of them across the county that cause an awful lot of problems. I'm just wondering, have there been many objections to this, or is it even widely known where it's going to be built yet, and what we're going to do to ensure that we don't have these problems when we do build it, with children smashing up the house, causing havoc in the streets locally and in local schools that are going to cause a lot of disruption.
Okay, so it's an existing house, so it's not been built. It has gone through due process. From memory, there were very little, I don't think there was any objections received. We're talking 3 children, and these will not be children that are at the, I suppose what our health colleagues would call as kind of tier 4 mental health needs. The house is regulated, and Ofsted regulated and visited, and we have to, and I am confident that with good staff directly controlled by the local authority, with really good management oversight, with the appropriate support to those children, we shouldn't see issues. We're talking 3 children, 3 young people. They are our children, and they have a right to live in a decent area. Unless we want, I suppose, I really don't want to create somewhere that's a ghetto of children's homes. We need young people to appreciate it, particularly for these young people who've had a difficult life and are challenged, what it's like to live in a usual, normal community, as part of a community, with the responsibilities that go with that, to attend local schools where they've got local friends, and they are supported by the staff in the home through their needs, and expected to behave accordingly. Where we do have issues, we will have to address them on individual plans. But I am hopeful, given the size of the very small residential house, in a nice neighbourhood, there has been no pushback from the community as far as I'm aware. The local members were supportive of it, and it will be controlled by us rather than us having to deal with a third party in terms of trying to manage any behaviour issues. What I would say around any independent residential home anywhere in the county is that I am never consulted around whether it's an appropriate place for a home, or it has nothing to do with children's services at all. It is Ofsted that agrees it's an appropriate place and regulates it.
Thank you for that. I think there does seem to be some evidence nationally that it is a good working model. So, yeah. Councillor Sutton.
Yeah, thank you, Chairman. I just wanted to actually support the comments that have just been made by Helen in relation to that. As local members, I think we all, some more than others, because of the location where we are, have children's residential facilities in our area. In the very, very vast majority of these cases, these are run by private organisations, and will take children from any local authority potentially in the country. One of the principles that we're working towards with together with restorative practice is where children do have to be in a residential home, that home is within Staffordshire as far as is possible, or certainly within the vicinity of where they're from, which really does help and assist, if nothing else, in social worker time, in having to travel the length of the country to go and do a visit and see how that child is getting on. And as Helen pointed out, we don't have any say in whether a organisation decides to buy a property and turn it into a residential care home. But what will be in this case and subsequent cases, should we choose to develop this further, that these will be children, Staffordshire children, and we will have that control. We will run the home, so we'll have all that sort of control that we do not have in relation to residential care homes that currently exist within the county.
No, thank you for that. Councillor Wilcox.
Thank you, Mr. Chairman. Helen, as an authority, how do we evaluate our performance and our success? Is it as simple as in children's services, the numbers of children in care, or is it about actually moving children back from the brink, back into sort of early intervention?
Yeah, predominantly the latter. So the aim of a restorative practice model is to keep families together wherever possible and to de-escalate by whatever intervention goes alongside a family to manage the crisis, take them out of crisis. So what we would hope to see ultimately, and it takes a long time, you know, are the numbers of children in care reducing as there is obviously once they reach 18. But there are also, we do work where maybe children have come into care through a significant crisis. Something's happened, which has pushed the family over the edge. One of the facets of the new model, which we haven't done particularly in any great volume in Staffordshire before, is you could have worked with the family for 3 years and something's happened and suddenly that we felt there's a safety risk and that child's come into care. We then say bye to the family. We've invested all this time, effort and resource, where actually if we continue to work with the family, we could see, like the most successful local authorities like North Yorkshire do, reunification, so that the child return home. Because we know that 90% of children who are in residential care, when they leave care, go straight home. And so we have no say when they're 18 and a day, whether that home is appropriate, but at 17 and 353 days, we're saying it's not. So there is, how we measure success is trying to move children down the system. Most importantly, I guess, it's the outcomes for the children. So it is monitoring really how they're performing at school, that they, at whatever part of our system, that they're getting the support they need to do as well as they can, that they're getting the opportunities they need, and that they don't bounce back in on a revolving door. Because it would be very easy actually to close quite a lot of children's cases down prematurely and then to see them 6 months later because there's another referral in. So we measure the rates of re-referral and we are lower than national and regional averages on that. We're measured by Ofsted till we're measured by the wrong things by Ofsted, which is numbers rather than impact and outcomes, but we obviously have to do that. What Staffordshire is known for by Ofsted, and indeed the regional director of Ofsted said this to me at our annual conversation a couple of weeks ago, is for its stability. So there isn't a right number of children in care or a wrong number. It's where things from year to year are wildly fluctuating. Same with the amount of children on child protection plans and so on. So it is stability we look for. The biggest challenge in terms of performance and the difference that we make in Staffordshire is its scale. So I have 40 social work teams, none of whom sit in the same building as me. You know, if we were a small Met in the West Midlands, where the Director of Children's Services has 4 teams who walks out her office and there they are, it's quite easy to ensure consistency, that every family across the county is getting the same level of service, the same quality of service, the same support. It's actually really difficult when you're talking leak to codsal and every point in between, because at any time across the county there's a team that's having an issue. And that is one thing that Ofsted also checks, is that in a shire, which is why sometimes it's harder for shire authorities to do well in Ofsted terms, because it's harder to demonstrate that consistency. But ultimately, it's around, if we've got children in care, are we supporting them to achieve the best that they can? So how many are doing well at school? How many are going to university? How many have got a job or training once they reach 18? How many feel happy and supported as they move into adulthood? In terms of child protection and children in need, it's how effectively are we working with the family to keep them together and ensuring that the child is still having a fulfilling life.
Thank you for that. Councillor Sutton.
Yeah, thank you, Mr. Chairman. Perhaps I could just come in on one of those particular points, and that's around the children that we have in our care. And I think maybe it's an appropriate time, although it was mentioned by Helen, just to briefly talk about the corporate parenting panel and everybody everybody's responsibility here as a corporate parent. Everybody, be they officers or members in this local authority, are corporate parents. So you all have a responsibility to ensure that we as an authority and as a group, as a partnership, are doing the very best we possibly can for the children that we have in our care. And the mantra I try to use is, if it's not good enough for your own children, then it's not good enough for our children that we have in our care. So around children who are actually in our care, this committee will probably not see as much stuff come through as in other areas, because there's a corporate parenting panel that meets monthly, that looks at a lot of the criteria that Helen just spoke about, how those children are doing, the services that are provided for them. And myself and two other people sitting around here are members of that corporate parenting panel, you know, and Natasha Moody, at my right, also sits on that panel from an officer's perspective. Each year, the annual report of the corporate parenting panel comes to full council, so you'll have an opportunity to see that in the not too distant future, because that's just being finalised. And another plea, slightly connected, I think, to your role here, well, very much connected to your role here, is you'll all have had an invite to undertake level 1 safeguarding training. Now, every councillor has that, but sitting on this panel, I would suggest that you have more of a responsibility to ensure that at the earliest opportunity that you carry out that training. We all have to do it once every 3 years. You know, that includes myself, so I'll just emphasise the need to carry out that training. Thank you, Mr. Chairman.
Thank you for that. I think I'd just echo that point. It is important, and I think we've just received some dates several dates where we can do that. So again, I'd urge members to do it. I can't see any more hands, so I thank you very much, Helen, as usual. Comprehensive and really useful. Thank you. That was really helpful. Going on to item B of 4. Councillor Sutton, I think your perspectives on future scrutiny?
Yes, I think what's important to emphasise now, of course, this is not just a scrutiny panel, is it? It's overview and scrutiny, and I think that opens it up a little bit more. I made a list of 7 or 8 things here that I thought that would be worthy of your consideration about whether you want to look at these from either an overview perspective or a scrutiny perspective. The first 3 were on the list that Helen provided. So my first one that wasn't on Helen's list, but was mentioned by Helen as well, and that was that neglect, that sort of low-level neglect that in itself, that one incident does not trigger any intervention, but a lot put together clearly is concern. And that's not just about ourselves as an organisation, but a partnership approach. So that would be my first suggestion. My second suggestion would be generally around prevention and early intervention across the whole of the system and how well that's done. The next one would be something that falls, I think, and this has always been difficult to know exactly where this fits, and that's around the SEND review. Special education needs and disability education is particularly something that the Prosperous Committee normally looks at, but when we've looked at SEND previously, we've had a cross scrutiny approach to it. So that might be something else, particularly how we as an organisation and how we as partners has responded to the SEND review. My next one would be around early years, and by early years I don't necessarily just mean the provision that's provided, the nursery type provision, but that's what we do as a partnership, what we do as an organisation, particularly for the under 4s, and members may well have seen, read or heard about the led some review that was a report recently. And that links in, I think, as well to what we do with children's centres and family hubs and how we do that. And that all in itself links into that prevention and early intervention. And that's an area of business that is generally led by Natasha, sitting to my right. And then the last thing, and I think you've already perhaps picked up on this, Mr. Chairman, and it is very well worth reading the review, the Case for Change review by Callister that was out this morning. And then I did make another note of something, again, something that Helen picked up on, that we have been working on, or trying to work on across partners, and is that how the governance model of a lot of this works together, and whether you feel there's a role in an overview or scrutiny of how we try and develop a more effective, perhaps less bureaucratic governance model. So that's my sort of thoughts and ideas.
No, thank you for that. I think what might be an idea, I'll open it up in a second to the floor if anyone has any views on any of those things that Councillor Sutton has just suggested, or any others, and then perhaps we take it away to work up just how we would present something like that, because there are quite a few other important issues as well. So rather than crowd the diary with them, it is about what are we going to look at around some of these things as important as they all are. Does anyone have any other views? Nope. Okay. I also think we are the designated crime and disorder panel as well, aren't we? And I think my mistake, I didn't invite the cabinet member for communities around that, because I do think that there are some additional issues that perhaps we ought to be considering, not least all the fact that we now have a new crime commissioner. So I think it is about that strategy as we move forward, and in particular some of those things that constantly crop up around how we deal with crime and disorder. So I think we need to build some of that in as well. So if members are happy with that, I'll get something together and I'll send out an email, and we can have a conversation about how we move forward with some of these suggestions. So thank you, Mark, for that. No other questions? No. Okay, we'll move on then to item 5. Mark, do you want to open this first, or yeah, over to you.
Yeah, cheers. Again, thank you, Mr. Chairman. Over time, I, together with officers, will bring a number of reports before an item goes before Cabinet. And I really welcome that sort of scrutiny of the reports that we bring and the direction that we are taking, so that everything that we think about and decide that's a good idea might not always work perfectly, and members around this chamber, as it is at this moment in time, will clearly have ideas that will help and influence what we do, and that good scrutiny is absolutely essential. So today's item is the outcome-focused one-to-one support and home care and community support, including domiciliary care for Staffordshire children with disabilities. The report has been written by one of our commissioners in that area, Martin Bagley, who's not with us at this moment in time, but Natasha, who is Martin's manager, is here and will help to present this once I've done my sort of introductions. I won't read the recommendations because they're there for you to see, but I'll just speak about a little bit of a summary. Now, the County Council has a legal duty to ensure children's community support, including domiciliary care provision, is in place to support children, young people with a range of disabilities, and this is an important bit, who have been assessed by a suitably qualified social worker as being eligible for a personal care service within the family home and the local community. So providers support children and families, providers support children and young people with a range of disabilities, including children and young people with physical and learning disabilities, autism and challenged behaviours, and many children have multiple needs. They provide a range of care packages across Staffordshire which are tailored to the specific needs of eligible children and young people. Similarly, the County Council has a legal duty to offer a range of commissioned community and short break opportunities, ranging from community-based breaks of a few hours to overnight short breaks for children with disabilities under the Breaks for Carers and Disabilities Child Regulations of 2011. And this programme of support is known as Aiming High for Children with Disabilities in Staffordshire, and augments our own in-house and commissioned overnight short breaks units and the support of short breaks foster carers in providing a range of short breaks for children to give parents and carers a meaningful break. And lastly, the County Council currently commissions a range of providers across Staffordshire to deliver children's community support and short breaks on behalf of the local authority, though they are currently commissioned and contracted as two separate support programmes. These proposals will advocate the benefits of bringing these arrangements together under one commission to provide more flexible, responsive support that draws on children and families' existing strengths and focuses on development, independence, preparedness for adult and cost effectiveness. Before I hand over to Natasha to take us through the report, first I just wondered whether Helen got anything to add or not. Okay, in which case I'll hand over to Natasha, Mr Chairman, if you're happy with that.
Yes, thank you. Over to you then, Natasha.
Okay, thank you. Morning all. So I shall quickly talk you through the presentation, which I'm hoping again Helen will ably assist with. So just to start with, I wanted to start with some of the strengths of the existing service provision. So we are actually working from a position of strength, I think. The current contracting arrangements do help and support us to meet our statutory requirements. They're well managed, they provide good value for money, and over the last couple of years we've taken some steps to make sure that we've benchmarked how much we pay compared to regional local authority comparators, and actually we do provide exceptionally good quality for value for money. The existing framework does meet the needs of most children. However, over the last couple of years we've seen an increasing number of children who can't be supported through the existing framework, and that's largely because at the start of a procurement process we'll go out to tender and the market that's there at the time will respond to that tender, but we don't have the flexibility to add providers on over the period of which we're contracting with them, and so quite often you'll have a number of children who've got quite complex needs who are unable to be met by that framework. And so the recommendation today is to make sure that we've got a more flexible arrangement through what we call a dynamic purchasing system, which allows providers to join throughout the contracting arrangement time with that provider. So if the provider, if the arrangement we have is for 4 years, providers can join any time throughout that 4-year process, which will hopefully give us increasing flexibility to meet the needs of those children across that 4-year cycle. And also try and reduce some of the costs of those off-contract arrangements that we've got. We've got a positive relationship with the market, and we've had a lot of feedback from parents to say that actually the support that they receive is good and helps them and their families to remain independent and resilient. There are always things that can be improved, and so as part of this process we looked at actually what are the things that aren't working so well too, and we've highlighted some of those things on the slide for you there. So as I mentioned, the flexibility isn't always as good as we'd like it to be, and what parents have told us over recent years is that actually sometimes it's really difficult to understand the wealth of support that's available. There's so much out there, including what's provided by the community, what's provided by us, what's provided by other people, that actually sometimes find it difficult to find the services that they need and to help and support them at that particular time. And so we thought that by pulling these two services together, that might actually help to provide a more seamless offer of support, which could be easier for families to access. In addition to that, parents have asked us quite clearly to make sure that the way in which we communicate the services that are available to them is easy for them to access, and they've said to us that they would really like videos that kind of help and support them to understand the range of services that are out there. So one of the things that we will do if members are supportive, is we will make sure that videos are available to families to make sure it's really clear about the services that are available under this particular framework. Could we move along, please? Thanks. I think it's the next one actually, Helen. I've cantered through quite quickly, I'm conscious of time. So this diagram tries to articulate and put in a picture the overlapping nature of the support. So as you can see in the middle is the bit that could actually be covered under community support or short break. So actually bringing these together we think will allow people to get some of that life skill support in terms of the short break activities, but also as people start to get you know, maybe need some short breaks, actually they can be offered some of those independently too. So again, we think there is a natural way to bring these together to provide a more flexible offer for families. If we can move along. So this slide starts to show you really the demand that we see in terms of some of these services. So we've seen a steady increase in recent years, but as I've just described, we have seen also an increase in terms of the number of providers that aren't able to meet the needs of some of our children. On the next slide, we demonstrate the annual spend across those service providers. So what you can see here is that actually we are spending less in terms of these services, although last year was quite significantly impacted by the COVID pandemic, where less children were able to undertake some of those life skills and independence, which is starting to steadily return to normal as restrictions are eased. So we anticipate that the demand for those kind of services might increase as we move forward. And then, so I just wanted to talk to you a bit about what we did. So we did quite a comprehensive options appraisal, and we considered 5 key aspects. So we considered whether or not we would carry on as we are, we would do something around in-house delivery, whether we would align some of our work in terms of community care with adult framework, look at a one lead provider model, or an open tender with lots, which is the one that we ended up preferring in the end. Those options were tested against a number of evaluation tests, which are outlined there. And actually what it showed us was that although option 5 was a winner in terms of meeting the most criteria, that the in-house model was a close second. And so over the period of time that we let this contract, our intention would be to explore that further to see whether or not that was something that we do need to consider as we move forward. But actually, what we did decide was that 5 gave us an option. Option 5 gave us a really comprehensive way, I think, of flexibly procuring the service, which would secure good value and good outcomes for children over the course of the time that we let that contract. So the recommendation for today is to seek member support to proceed on that basis. And on the last slide, we've just outlined some of the key interdependencies for you so that you can see what they are. As we've kind of mentioned really, the support that's out there for children with disabilities is quite complex in terms of some of that's provided by health, some of it's provided by the local authority, but we are working with a range of different providers and partners to make sure that we get an offer that feels like it's fit for purpose. And then on the last slide, we've just outlined the next step. So as Mark said, after today, it will go ahead to Cabinet, but we are really interested in members' views about whether or not they are supportive or think there are any things that we need to consider as part of that. So I'll hand over to you for any questions.
Thank you for that. Would I be right in assuming that this process is dependent on outside providers coming in to provide some of that or a variety of that care? How confident are we that that will happen? I know in the report it talks about the majority of providers seem to prefer the adult support. I assume that's financially better for them. So for this to work, how confident are we that we will see that increasing and also an increasing variety of providers to do precisely what the report's talking about?
That's a really good question, actually. From our perspective, we're confident that we will get a broader range of providers for a number of reasons. So we've been doing a lot of work regionally with other local authorities to try and increase the number of providers in this market space. And actually, we have been talking quite a lot to adults in terms of making sure that there is a conversation about children's and the need to kind of work with us in terms of making sure that that's seamless and we get perhaps more adult providers coming into the children's space. And I do think the COVID pandemic presents an opportunity really from a children's perspective, because actually it is a continuing market, and actually some of the changes we might see in adults might actually work in our favour. I think the dynamic purchasing system also gives us the flexibility to continue to work with the market. So you might open the tender at the beginning of September, but actually through the course of that 3 to 4 years, you can be working with the market. So where you have got particular pressures, you can be going out and talking to people and trying to encourage people to apply for that locally. And so you'll see in the report that there's mention of working much more on that place-based footing in line with the Children's Transformation District model, in terms of actually having conversations with people who work in that community, who understand those children, that might be able to step up and explore working in that space, that might not have actually considered that to date. So we're hoping that that approach will make sure that we've got a range of providers that can help to meet that need.
Are we providing any incentives or training? You were saying that you hope that that will happen. I suppose this is important, of course, and we just want to make sure that we have a little bit more than hope. I don't mean to be rude, but is there anything that gives us some reassurance that we will be in a position where this variety of support and volume of support is where we need it to be?
I would say that some of the work we've done more recently in terms of the place-based approach and trying to encourage providers from voluntary sector and community sector organisations has been quite successful. And it's because we've tried to work with the community differently in terms of understanding what the opportunities are available and supporting them to access those opportunities. So, for example, when we commissioned the Family Support Service, we worked with a range of organisations to help them understand the procurement processes, what they needed to do to get through that. We offered them some training and support where they'd identified potential gaps or they'd got concerns about something. And so I would say that we would absolutely be trying to do that with this cohort. So if we hear concerns from the market about their not wanting to apply because of workforce and skills needs, then actually, yeah, we would be working with that sector to make sure that we're giving them the skills that they needed. In addition to that, we're working with the CCG, and actually they've received some money to work differently with learning disability and autism, and part of that is about the training and skills available across the local authority and in the CCG. So again, there's an opportunity there, I think, to link some of these pieces of work up.
No, thank you, that's reassuring. Any other questions? Councillor Bennett.
Hello, Natasha. How does the social worker ensure that the child is getting an enriched and fulfilling wraparound care? We're told that this is happening, but what evidence do we have? I mean, I've been out there and I've been working with various children with autism and different difficulties, and we're being told that they're getting this care, but I've seen evidence that it's not happening.
So the social work assessment is separate, I think, to this piece of work, but what I can tell you is that actually, from a social care perspective, we do audits of files. So we do look at the files that we work with to assess whether or not they've had the support that they need. Most of the children that come into contact with these services are really acute, so they're the top end of the triangle. There's not many, and I think in the paper it gives you an exact number. I think it's about 150 children in total. So you might be talking to children, but they might not necessarily be the children that are accessing these services. But if there was ever any issues, you'd be more than welcome to raise them with us and we could look into it.
Can I also ask as well, on the short breaks, there's often little or no money to back up the children's needs. So they'll go to one of these short breaks, for example, and it's giving the parents a break, but the child's basically moved from one house to another, and they're not actually doing anything with these children. So they might be put in front of the television to watch a DVD, or they play board games. Is there going to be any provision to take them out and involve them in community activities?
So in relation to that, we also run a separate programme of Aiming High, which is about just that. So it's about community-based activities. So there is a scheme that's currently run with a number of providers on there that offer a range of days out, experiences with children, all sorts of kind of different provision really that's run in addition to this. In terms of the short breaks and the quality of the provision, so the quality of the provision is monitored. We do go and look at the provision that's offered, and we also do work quite closely because these homes are inspected by the CQC, so all of the providers should have been CQC inspected and will have a rating that means that they're fit to work with these children. So again, if there are particular concerns, we'd look into those, but we are assured at this moment in time that those provisions are there and delivering what they should be.
The only trouble with that is a CQC give quite a bit of notice before they're going into these homes, and these homes make sure that they've got the correct qualified staff on at the time, and they make sure that the notes are all up to date and it's looking really good. But this doesn't always happen behind the scenes. And I want to know what we can do to make sure that this is going to happen.
I would say through the contract management requirements that we have with the providers that we're confident that it's being done. I think if you have got an example where it's not being done, we would be more than happy to look into that. So if you've got any examples or you've heard anything about providers, then by all means get in touch with Martin or myself and we would be more than happy to do something. But I think from the contract management we've got in place, the rigour that's provided around that, we're confident that at the moment they're meeting the requirements that they should be.
Thank you for that. Councillor Ford.
Thank you, Mr. Chairman. Thank you for the report, and I'm particularly quite supportive of the recommendations, particularly not number D, letter D, which is the use of the first 2 years of the new contract to further investigate the merits of the risk associated with in-house delivery. Reading through the options appraisal, I got more and more intrigued as I read about option number 2. The first risk associated was that relatively low numbers of children, young people and families requiring community support services may make it difficult to develop an internal service model delivery. My question would be, like other services we provide cross-border with, well, we mentioned earlier, with Shropshire, Telford Record and Stoke-on-Trent, is there any option for doing that similar with that one?
Sorry, Chair, I missed the last part of the question. Yes, so apologies. Telford and Wrekin have just gone out to tender on a framework. They're the first in the region to do it. We're cautiously watching that. We are not convinced that actually it'll deliver what they need it to. So I think we're hoping to learn from them as they go through that process. And Martin does have really, really strong relationships actually with Telford and Wrekin to see whether or not actually it is delivering. So again, if there's lessons to be learned from others, we will absolutely adopt some of those. So yeah, absolutely.
I'd be very happy to be kept updated on the progress of that as we investigate it over the first 2 years of any new contract, and be very happy to see it come back before the committee at some point.
Thank you for that. Councillor Podesta. Microphone.
A couple of times in this document. Thank you. A couple of times in this document it mentions about recruiting more appropriate staff for the social care sector, and the main reason it outlines is it not being attractive due to low wages. Could I suggest that we also emphasise the value of the work? For too long the social care sector has been devalued and demeaned. I have heard job centre staff say to job seekers, well, if you're going to turn this down, you're going to end up wiping bums. So it's also as well about emphasising the value and the importance of the work in the social care sector. And secondly, Chair, option 2, the in-house option, the paper does, I'm pleased to say, acknowledge the strengths and opportunities for more in-house delivery, and I do hope that we will be further investigating that, particularly as you just alluded to, Chair, that with too many providers, the chances are they're just going to cherry pick and take those parts of contracts which they find more financially lucrative. Thank you, Chair.
No, thank you. Thank you for that. I think you make a really good point about making this provision attractive to providers, and I'm assuming that the conversations that we'll be having with prospective providers will be increasing the attractiveness of the role. Sorry, Councillor Sutton.
Yeah, just picking up on those couple of points. I mean, the first one around the attractiveness and the social care workforce itself, and making that. There was a point that Helen raised earlier, in particular, of how many what the great shortage of social workers across the whole of the country is. I mean, every night we sit down, don't we, and we watch the telly, and there's dramas about about the police force, detectives, and all that sort of things. There's dramas about hospital staff, medical staff, and all that type of thing, that I think helps to raise the profile of those professions nationally. But actually, is there much about social workers, either from a children's perspective or also from an adult's perspective? And there probably isn't an awful lot. And where there is, it might be a fleeting part in a drama or about something else, and not always in a positive way. So I think we all have a massive role, not just us, but I also think national governments have a great role in playing in trying to support and show the great value of children's social care in particular, but adult social care as well. And the second point is, I'm very mindful of ensuring that we keep an open mind going forward about the best way of providing this or any other service that we commission or provide ourselves.
No, I think you're absolutely right, and I would echo those comments. I think it is important, and I think as the report sets out, and we heard from Natasha, that these processes are under review, and I think it's healthy that we're in that position. So thank you for that. I'm just looking if there are any other comments. Yes, Councillor Pradesh.
Thank you, Chair. Just two very quick points. The paper also says that the Commission providers will be required to upskill and involve community workers and the voluntary sector in service delivery. And I'm assuming that we will keep in mind the voluntary sector was always set up to complement statutory services and not replace them. So if we can remember that as we're developing these policies. And lastly, Chair, sorry. Okay, I'll also be keeping a close eye personally on how one provider whose background is in working in the adult side of things, how they're going to be expected to take on work and contracts that also are working with young people and children. Because my understanding is that they're two very different sets of skills and experiences and so on. So I'm just, I'm assuming that has been taken into account, that the provision and the move for providers to do that is going to be monitored very, very closely, so that the young people and the adults are still being provided a service which is going to be very much appropriate for their needs and the services that they need. Thank you, Chair.
No, thank you for that. I think you make some good points. I do think, though, it'd be remiss of us if we didn't explore any potential crossover between adults and children. I assume that there are some lessons for us to learn there, and I think it's encouraging to hear that we are considering that. Did you want to add anything else, Natasha?
I just wondered if it might be helpful to also say that we have worked quite closely on adults with the development of this options appraisal. They were part of the panel that made the assessment, and quite a lot of the children that do access provision do transition into adults. So I do think there is some benefits in working with them, but I absolutely take your point. And I suppose just to come back on the community bit, we absolutely recognise that the communities are there to complement the services that we provide, and that's an underpinning principle of the children's transformation in terms of that place-based approach. So we absolutely will make sure that we work with the community and voluntary sector as best we can, but to add value.
Thank you for that. I'm not seeing any other hands. So perhaps if I could take members back to page 43 and the recommendation that this committee agree the initial list of priorities to form the basis of the work. Sorry, I've got the wrong one there, haven't I? The recommendation that this goes forward, I think, to Cabinet. The recommendations on page 7. Are we happy that we accept those recommendations?
Sorry, Chair. Do we have an opportunity to... we're on the work programme planning...
Sorry, no, I think I got the wrong report.
All right, thank you,
This
Chair.
is a different. My fault. Thank you.
Yes, thank you, Chair. Right, I'm very conscious that we've had quite a full meeting so far. This item is really looking at some of the things that have been discussed already this morning, looking at how you put your work programme together for the next municipal year. So the paper there just outlines briefly what the remit is for this overview and scrutiny committee. And you've heard this morning the remit is broad, very broad, so there are a lot of areas there for you to consider, including on your work programme. It looks a little bit at or suggests some methods you might use in how to prioritise your work, because clearly there are going to be more things, I think, that come forward for you to include on your work programme than you're going to be able to do. So it just suggests there at paragraph 6 that you might want to consider matters that are of particular concern to local people, that are a priority for the council or for partners and so on. So depending what is put forward, there's a need to look at that and prioritise appropriately. Then at paragraph 7, there's some information there on items that were outstanding from last year or indeed are likely to need to be included again this year and have already previously been scrutinised. Helen raised some of those with you already. So there are some really key changes to delivery of children's services in particular, and that we're looking at in the Children and Families Transformation, which has come to the Scrutiny Committee previously, and as she said, it's expected that because this is such a key and significant change to the way services are delivered, that you will probably want to look at that again. Again, Helen mentioned child sexual exploitation and young people missing from home as something that this committee has looked at regularly, because it is a key priority to address these issues for the council, and that has moved into this contextual safeguarding, which is a fairly new concept and which the previous Scrutiny Committee did quite a bit of work on to bring themselves up to date on what contextual safeguarding actually meant. Now, obviously, we are a new set of members and a new committee, so you may want to have some more detailed information on that. It might be that you want to ask me to get together a summary of what the previous committee had done so you can update yourself on that. It may be that you want an officer to come in and talk through on that specifically. But again, that's something that is an ongoing piece of work. It's quite a significant change, so you may very well want to make sure that's included again. Domestic abuse is the next item. This was something that members had requested early on last year, and clearly when the world turned upside down, and we're still not quite back straight again, are we? But the report that would have come to the committee didn't at that time. We took a briefing paper. I can send that to members as well to update you if you would like. But members had asked that further detail came to them at some point because they're specifically interested in whether or not the pandemic had had a significant impact on the numbers and how we were addressing that. We have actually penciled that in consultation with the chair for the July meeting, if everybody's comfortable with that. As have we penciled in the Regional Permanency Partnership. Again, Helen mentioned that. This is the regional adoption agency, essentially, that has been created jointly between the councils. It's fairly new. It's only been running for approximately a year. And whilst the previous scrutiny committee considered the proposals, they said, well, we'll need to look at this again and see how it's going. So again, in consultation with the chair, that's been penciled in for July. It's run for 12 months, so it's about looking at, how's it working, how's it bedding in, are there any concerns, how's it moving forward. The final one on that list was safeguarding adults on the cusp of care. Ruth this morning, who very kindly came and talked through a little bit about the adults safeguarding. It's a tricky one, this, because adult social services sits with health, but the safeguarding is in here. So you will find on a number of occasions there's all these things that where does it actually sit and this crossover. That's not particularly an issue. I think the key thing is that the chair and the officers are talking to each other so we're not duplicating. And on occasions there will be joint meetings, there might be a working group, an inquiry day where we have joint membership. But this was suggested at the time by the then cabinet member responsible for that area as a possibility that, as a piece of work, to look at any gaps in provision for adults on the cusp of care. Then moving on from that, another area for items for inclusion would be key decisions, and again, pre-decision scrutiny. We've had an item here today. My apologies really to you all. It has been a fairly epic meeting. I know there is a lot of information being thrown at you. Because of pre-decision scrutiny on that previous item, it needed to come today. Ordinarily, we would have just looked at the remit and work programme. So, you have been bombarded. I do know. I am sorry. But that's how we look at these items. Do you want to come in there, Mr. Okay. And then on from there, you've got a list of things that come annually. Again, Helen mentioned some of these. So there's annual complaints reports. 2 of those we have, you'll have noted, hopefully, put in an extra meeting in August because previously when they've come to members have been uncomfortable about the fact that they were a little bit later on in the year coming to you. And so wanting to get it as early as possible. So we've put that extra meeting in there and penciled those in for that. They are reports that are written in a similar format every year, but from those, obviously complaints and representations, they might very well prompt a concern that you want to look at. So it might generate specifics that you feel you need to look at in more detail. And then you've got the other annual reports which will routinely come to you. A little bit about training and led by yourselves entirely. There is a huge amount of work here, some of which you'll have background in, some you won't. If there are things you want more detail in, please let us know through either myself or the chair or vice chairs. We can do it in a number of ways. We can, I can go through and find the information that pertains to it that this scrutiny committee has looked at before, so you get a background reading, or we can ask an officer for a briefing paper to bring you up to date with where we are now, or we can have some face-to-face training outside of the meeting. But if you feel there's something that you want more information on, please do let us know. I am very conscious that there is so much and it's impossible to get all the detail you need on everything all in one go. So, to dip in at and get specifics on something that you are keen to have more information on is absolutely the right way forward. Little bit about methods of scrutiny there. So we have the formal meetings. We are more formal than normal because we have to distance. We are in this room, which isn't really the best room for us to be in for a scrutiny. It's not the friendliest of rooms, is it? We're not close together discussing it and debating it. However, this is how we are for the time being. So I have booked this room for the next 12 months simply because then I know that we are covered and we can have cabinet members and officers in the room with us, which I think is better. Not ideal, but better. However, we don't have to do it through the formal meetings. We can set up inquiry days. We can set up working groups. There are a number of ways we can get information and we can do scrutiny. So it's really to be led by yourselves on where you think, how you think the most appropriate way to do that scrutiny is. And then a little bit about the work programme. So the work programme, and I've appended to this two work programmes, the one from last year just for information really so you can see what was done, and a draft for this year, it is a flexible document. So whilst this will come to every one of your formal meetings, the work programme will be available. So it's always available on the website as well. And there are some things that we'll pencil in, but we can change as and when needed. So if something comes up that you feel is much more important than the items we've currently got on, there is no reason why we can't put that in and move things around. It is your work programme and is flexible to what you feel is most appropriate. We set it out in this way so that you've got, obviously the date and the name, you've got a contact, the key officer contact and the cabinet member contact there. You've got a little bit of detail which explains why we've put it on in the first place. And then after the meeting, I'll fill that in on the right-hand side, which gives outcomes and actions. So it should be a very quick and easy synopsis for you about where we are with anything that we've looked at. And you can see there, we've penciled in consultation with the chairman, I've penciled in the July meeting simply because this is a very busy committee and people are requesting already that we look at things. So the Regional Permanency Partnership I've mentioned and domestic abuse I've mentioned. Family Hub is an item for pre-decision scrutiny. It's going to Cabinet, so we've slotted in there. And the August reports we've got so far as well. That is, I don't really want to go into much more detail because we've already hit 12:05, but that's a canter through just to say any concerns, any issues, anything you want to raise, drop me an email, the chairman an email, and we can address those.
Thank you very much for that. Councillor Perry.
Thank you, Chairman. Just to say they're all very important topics, obviously, that we've listened to this morning. It'd be interesting to see what happened at the last, safeguarding that you mentioned. You might want to bring us up to speed with. But I just want to raise one thing with you, if I may, Chairman. I don't know where it sits in this, but it is about safeguarding our teenage young people. There are a number of issues I just know personally from my neck of the woods. I don't know whether anybody else has experienced anything. Obviously, children have had a lot of time on their hands over the last 12 months or so. And we do get cross-border in my division, as you're probably aware of. And there's been an awful lot. We've had riot vans and all sorts, which is not the norm for where I represent. So I would like something somewhere to sit in what provisions we've got, what's out there already that there isn't, or what isn't out there that we might be able to facilitate or get other people to do. So I'm just concerned that we've got holidays coming up again. Lots of young people now haven't sort of finished school, they're out of school and not knowing whether they're going to university or jobs or whatever. I just think we need to know a little bit more about, and I'm concerned, and it is a safeguarding issue, because we all know what can happen when we get cross-border issues with safeguarding our own in Staffordshire young people. So I'll put that to you. I don't know where it sits, but I think it'd be interesting to see what we can come up with, Chairman. Thank you.
Yes, thank you for that. I also go back to the fact that in the report we are the designated crime and disorder panel. So whilst a lot of the time and effort is taken up in safeguarding young people and adults, we shouldn't forget that we are the crime and disorder panel as well. And I also echoed the points that you've made, and also talk about the new crime commissioner. I know that I've had some conversations with him. He has a different view of how we're going to achieve that. So I do think there's some more liaison around how we're doing that, and that will include some of the points that you've made. I also raised with him, because I do think there are examples of things that crop up, as Ellen was saying there. We have the work programme, and it's not unusual for that to change from month to month when important matters do come up. I've already raised with the Commissioner, and people may have seen it on the news, the issue around Usman Khan, who murdered 2 people in London. You probably know that he was a Staffordshire resident. He lived a matter of a stone's throw from this building. The inquest by a High Court judge decided that his management was woefully inadequate here in Staffordshire. So there is a potential for like-minded individuals. I have raised some concerns with the Commissioner to say that this is the sort of thing I think that we ought to be scrutinising as well, to make sure that the people in Stafford are safe from potential acts of terrorism. I only raised that as an example of another issue. I think you've probably got the view that there's probably far too much here for us to be able to get through. I do think it's about a prioritising process, and that could change over time. What I would invite you to do is perhaps reflect on what you've heard and what you've seen in these reports. Let me have any thoughts that you might have around some of that priority. I'll get together with the Vice Chairs and Helen, and we will come up with a proposal of where we see these meetings going. Part of that is about pre-decision scrutiny, so it is important that we give our views and thoughts to items that are going to Cabinet, so we will have to, and quite rightly so, include those as well. But also we want to make sure that we use the time properly to safeguard the people of Staffordshire. So please give it some thought, let us know. The last point I would make is, once we have a prioritised list, especially if you feel that you don't understand the subject matter particularly well, then it might be an opportunity for us to try to identify some training, a short amount of training before the meeting. So at least then people will enter the meeting with at least some knowledge and some background to some of these reports. We've done that previously. We've had working groups. Several of us went to, for example, the organisation that we used to send to those young people missing from home, called Catch 22. I know that the contract is up for renegotiation, but I use that only as an example. We got a lot of information, a lot of reassurance about how those young vulnerable people were managed in our communities. So that is another option for us, rather than sit here and read a cold report and have someone talk to it. It's always useful if you hear it from the horse's mouth, so to speak. Councillor Eagland.
Thank you very much for that, Chairman. It's been a full-packed meeting this morning. We've had a lot to take on board, and thank you very much. But I would like to add something that the Cabinet member for corporate parenting suggested we put on our agenda, is the young mothers and children below the age of 5. We seem to have a lot of infiltration and a lot of information coming forward with teenage children, and we don't seem to have an awful lot coming in from the children under 5 with their parents and their mothers. And I think this is, to me, I'm a member of the Family Information Board, Family Involvement Board, and they deal with, on that board of members, lots of people that deal with children of all ages. But I think sometimes, you know, these children that come over the age when they're unmanageable possibly could start from when they're younger, very much younger, with the parents that are young and just don't know how to bring up children. And these people that deal with the Involvement Bureau Board, they deal with children and mothers themselves from when they're pregnant to when they're breastfeeding, right the way through to when they go to school. And every district has got a FIB board on it. So there is a member on this county council that has a position on their local family involvement board. So I would like to encourage us, if possible, Chair, to put this on our timetable for the year.
Thank you for that. A good point. We'll give that some consideration. Were there any other comments?
Chair, I will put this in writing, but can I just very quickly outline three suggestions? In preparing for this meeting, I very much got the impression that when we're talking about carers, we're talking about adults caring for children and young people, but I was also concerned about our young carers, the ones who are caring for siblings or for adults in their homes. So there was the issue of young carers. We also, a few days ago, had a report on sexual harassment and sexual assault in our schools. So there's an area for scrutiny there on what schools believe is happening and what we can do about that. And lastly, we were only hearing this morning of the number of families who are being investigated for child abuse, and to scrutinise how many were ultimately found to be guilty following the investigations during, say, the past 5 years or so. Thank you, Chair.
No, thank you for that. I think you make good points there. I do think the one about how we investigate and the volume of investigations and how many people are ultimately ever convicted or charged with anything, as the McAllister report makes out, is very few. I think the judgment, though, is about whether those investigations are reasonable and proportionate, given the threat and risk that those young people face. And I do think that we can get a judgment around some of that from some of the issues that are currently coming forward, and certainly the reports that Helen pointed out, I think, will cover part of that. I agree completely with your point about are we missing those young carers who care for either other siblings or parents, or I do think that's an issue, and that's probably one that we ought to consider. Any other? No. It's been quite a long meeting, and I bet most people feel punch drunk with all of the information that you've had forward. I know the chief exec once described it as drinking from the water hydrant, I think, for those who heard him quote it before. So I apologise for that. I hope you've enjoyed the experience. I hope you've taken something from it. Please reflect, give it some thought about what the work programme is going to look like. It is flexible, but I am keen to make sure that we cover those issues that we've already heard members raise. So thank you for that, and I'll bring there's nothing else, is there? Oh, no. I'll bring the meeting to an end. Thank you.